And now, going off of that discussion of patient care, something that you've written extensively about is this sort of contemporary phenomenon where we see a decrease in new antibiotic development and an increase in diseases that are immune to those. Would you just mind elaborating upon that a little bit for those of you at home that might not be aware of what really this crisis is?
Sure. We are having a public health crisis of antibiotic resistance, not just in the United States, it's international. And in fact, the UN is having an antibiotic resistance meeting coming up in the next week because it has reached crisis proportions globally. We are not getting new antibiotics developed at the pace nearly commensurate with historical rates for a variety of reasons. So as resistance rates keep rising, as new antibiotic development declines, we're running into patients we can't treat, who have infections we can't treat for the first time since 1934.
Yeah.
And that is a very frightening thing for the medical community to confront.
And how do we end up with diseases that are immune to a lot of the antibiotics that we've had already? Is it merely just evolutionary on their part?
Yeah, it's natural selection. So the first thing we have to remember is we didn't actually invent antibiotics. We discovered them.
Oh,
Bacteria invented antibiotics about 2 billion years ago with a bee.
Oh,
They've been killing themselves with these weapons for 20 million times longer than we've even known they exist. So in 2 billion years of microbial evolutionary warfare, they've developed resistance mechanisms to protect themselves from anything we can come up with.
So they were way ahead of us by the time we came around for it.
So what happens is we get a new antibiotic approved, we start dumping thousands or even millions of kilograms into the environment. You kill off the susceptible bacteria, leaving behind the resistant bacteria to grow and multiply.
Yeah, and the book you wrote, Rising Plague, it was published in 2009. Have you seen any developments or changes in regards to this this issue since you've written that, or do you feel like it's either gotten worse?
The problem continues to grow worse, but the encouraging thing is that in the last 3, 4, 5 years, there finally has been meaningful mobilization of social and congressional resources. So there's some legislation that's been passed to help address the problem. The president has put together an entire panel of experts to try to recommend policy solutions. There has been large amounts of dollars poured into incentivizing new antibiotic discovery, both in the US and in Europe. So we have not turned the corner, but the tools we need to start to turn the corner are now in place.
Yeah, so the gears are kind of turning now for the development. And as you spoke with the meeting coming up, that has to be a big catalyst to sort of begin the whole process, right?
It's a symbol that people now are really understanding. We were, I started talking, publicly about this issue 15 years ago, and it was like, you'd talk and tumbleweeds would go by.
Yeah, so you felt like you were kind of talking in the middle of the forest, like nobody was, that's interesting.
Yeah.
And did you feel like eventually people started to catch on, and if so, why? Why do you feel like people started to catch on to that?
I think two things. One is I do think I and others were very effective at starting to get the word spread into the community.
Of course.
And it's in media now. MRSA, it shows up in movies, it shows up in television shows. People don't know what it is, but they know they're supposed to be afraid of it.
Exactly.
But the second thing is that I think more and more individuals have come into contact. They know someone who's had a resistant infection, sort of 6 degrees of separation. They've experienced it. And because the resistance rates keep rising, more and more people are experiencing it, and their family members are experiencing it.
Yeah, and now for somebody who might not be as in tune with whatever diseases may be developing as you are, what could the average citizen do to help fight this crisis or phenomenon that we see?
Okay, so number one, wash your hands.
Really?
Yeah.
Yeah, same thing with like the plague back in, we still haven't learned.
These are how we interface and interact with our environment.
Okay, so wash your hands is number one.
Wash your hands / good hygiene, number one.
Wash your hands.
Number two, cook your food and wash your vegetables. Number three, don't take antibiotics unless you really need them. We want to flip the script. You go to the doctor, you're not feeling well, you have a sore throat and a runny nose. Don't say I want an antibiotic. The question should be, do I really need an antibiotic? Flip it around. You don't want it unless your doctor says, no, you really need it.
Yeah.
We are massively overusing antibiotics, both in people and in animals, and we need to decrease our antibiotic usage. And then the last thing is, it's going to sound mundane, but live a healthy lifestyle. Most of the worst resistance is in hospitals.
Yeah.
If you end up in the hospital because you get heart disease or your kidneys aren't working, or you've got asthma, or you're smoking, that's where you have the biggest likelihood of picking up one of these resistant infections.
Yeah. So